Well, good oral health means more than just a pretty smile. Studies show oral health is directly connected to our overall health. Joining me now with more is the host of the Emmy award-winning talk show, The Doctors, Dr. Travis Stork. Good afternoon, doctor.
Good afternoon, and thanks for having me on. And you're spot on with the oral health part. And the reason it's even a bigger deal than most people realize is that 1 in 2 adults have gingivitis, nearly 2/3 of diabetics have gingivitis, and pregnant women, 70% of them have gingivitis, which is, of course, gum inflammation.
What's the problem with it? Is it just that it leads to bad breath, or what are the overall health risks to having gingivitis?
Well, I think we used to think of oral care as just you want pretty white teeth, you don't want to lose your teeth, you don't want cavities, and you want good breath. But really what happens is we're linking more and more how oral inflammation may be linked to overall body inflammation. So gingivitis, and folks may know they have it if they notice red swollen gums that bleed easily when they floss or brush. That can be gingivitis. And if you ignore it, it can lead to periodontitis. That's when you potentially lose teeth and lose bone in your mouth. The good news with gingivitis, it's gum inflammation, thought to be secondary to the bacteria and the plaque that live in our mouths, is it is reversible.
Is this a brushing problem, a flossing problem, a rinsing problem, or combined?
It's a bit of an all of the above. I am a huge fan of the Crest Pro Health Clinical line because it's all of those. It's using the regimen every day of brushing twice a day. It's flossing at least once a day, and then it's using the oral rinse after brushing, which is how I do it at least. And the idea is that you're getting basically into all the crevices, the nooks and crannies where those bacteria love to set up shop. And it's in those little spaces between your teeth and the gum line, whereas plaque develops, it leads to gum inflammation. And again, the good news is if you use a good regimen like the one I just mentioned, within 1 week, people will notice that their gingivitis is reversing, and if you continue to use it, you can actually prevent gingivitis from forming in the first place.
Well, I think that's the goal, hopefully, right, is that we do prevent it in the first place. You know, what about products that have whitening in them? Are they just as effective with the health overall?
Well, one of the big things, if you're going to use whiteners, just discuss it with your dentist because there are different products out there. There are a lot of different types of products. But the most important thing when it comes to oral health is, yeah, you want a nice, bright, white smile, so to speak. But the gum issues are something that, as a medical doctor, I'm more worried about. Dentists are more worried about nowadays because, again, this link between oral health, it is in many ways the gateway to our bodies. And we never in a million years, 50 years ago, thought that oral health and reducing gum inflammation might potentially reduce overall body inflammation. And so those gums, you know, especially again with 1 in 2 of us having inflamed gums, it's really something we have to focus on. So I highly recommend people focus on using oral care products that really do reduce gingivitis.
All right, real quickly, I know you're not going to say endorse this, but what if we want to have a soda now and then or some candy? Is it okay as long as we keep up with the rest of the good health?
As long as it's a treat. I always say the most important thing is that a treat should be a treat. It shouldn't be an every meal or everyday phenomena. And if you want to actually improve your oral health afterwards, just rinse out with some water. Chewing sugar-free gum after eating a little bit of candy can help wash away those sugars so it doesn't cause tooth decay.
Thanks, Dr. Stork, so much.